I'm Terry Kemple, and I'm going to talk about the Royal College of GP's Green Impact for Health Toolkit. We started this toolkit in 2014 when Bristol, my home city, was awarded Green Capital of Europe status. A number of us came together, and although we were all feeling a bit guilty about climate change, what we realised was we didn't know what we should be doing in our practices. It was all a bit too complicated, and it was difficult to know what to prioritise and where to start. And we all had a sort of collected aha moment where we knew that the health of the planet was threatened, we knew we had limited time to take action, we knew there were lots of co-benefits to health by addressing the causes of climate change, but most people didn't know what they could do, and more needed to be done, and it needed to be done faster. So, we needed a practical toolkit to answer the question, what can I do in my practice? And show how we can be more sustainable, save money in the practice by consuming and wasting less, share the work throughout the practice team, and in addition spread the culture of sustainability beyond the practice to our patients and others. We based our toolkit on an existing platform, which was the National Union of Students Green Impact website, which had been going since about 2007. And it had been used for student unions, universities, some hospitals, local authorities. But we developed the Green Impact for Health Toolkit, and this is written by GPs for GPs and is suitable for use in any general practice. Because we need to mitigate to avoid the unmanageable, and now we realise we also need to adapt, because inevitably there will be some changes coming with climate change, so we need to manage the unavoidable. So what is coming? Well, we know from the UK's Climate Change Committee, which has been going since 2008 and regularly assesses what needs to be done and what the risks are and maybe what we should be doing about them. That committee has assessed that we can expect flooding, risk to health from high temperatures, risk of shortages in energy generation, agriculture, water supply, risks to our natural capital, risks to food production, and new and emerging pests and diseases coming into the UK. In the UK, there will be direct effects, mostly from flooding, which will be more frequent and worse, and also from rising sea levels. But in other countries around the world, some will be hit with more and sometimes all of these factors of flooding, heat stress, water stress, wildfires, hurricanes and rising sea levels. So that will produce indirect effects, which will be pressure on for immigration from other countries because of the food scarcity and rising sea levels in their home countries. But to reach net zero and the 1.5 degrees target isn't going to be easy. We've really got to halve our emissions by 2030, and that's 5 times more than the current levels of national government ambition. Putting it another way, we need a 7.6% annual reduction every year in our global net emissions. And the pandemic only caused a global 8% reduction, although it was 11% in the UK. In the UK, the NHS causes about 4.6% of all UK emissions, and that's broadly similar as most similar countries. The US, it's much higher. And in addition to that, about 1 in 20 vehicle journeys is attributed to the NHS. The carbon footprint of the NHS has been mapped, and you can see in the pie chart on the left that about 65% is from medicines, medical equipment and other supply chain products. And it's broken down by activity on the right, and you can see in primary care, arrow 1, that although in arrow 2, a lot of our carbon footprint is from that supply chain, medicines and chemicals, also a large part is also from our prescribing of metered dose inhalers with potent greenhouse gases as their propellants. That's arrow 3, and also arrow 4, patient and visitor travel. Now that's all pre-pandemic, so that will have changed. If we look at the carbon footprint of general practice, then it's around about 25% of all of the NHS, but over 60% is down to the medical treatments. And the supply chain that we use accounts for 65% of our NHS carbon footprint. So it's going to be a big ask to get that down to net zero carbon, but everybody's going to have to do that by 2045. If we exclude the medical treatments in general practice, the remainder is in this pie chart, and you can see that the business side of general practice, a lot of it is patient travel and staff travel. Again, this was pre-pandemic, so that as we open up again after the pandemic, we need to make sure that whilst we optimise patient care, we reduce all unnecessary travel. The NHS has mapped out the actions it needs to take, and these are all at the same time that we must be taking these actions. This is in a bit more detail, or make it easier to read. So there's a lot to be done. We've also mapped out a route for an average general practice to reduce its carbon footprint by at least 50% by 2030, and probably even more. But the most important and the most difficult part of this is starting, just starting. Now I'm going to look in more detail at the actual toolkit itself. This is the home page, and if you look on the left, you can see various tabs for various categories. So if you're only interested in one or two of the categories, all you have to do is go straight there and get to where you want to go. If you're interested in seeing what's in the toolkit without registering, if you go up to arrow number 2 and click on help, then in the second paragraph, if you click where it says here in what are the criteria in the toolkit, you can download an Excel type spreadsheet, and you can see all the criteria, and you can pick and choose which ones you think are relevant for your practice. You don't have to register. But if you do want to register, you click on the register button, you come to this page, and if your practice is already registered, then you need to go to the drop down menu, find your practice, and then register your name as a user for that practice. There's about 900 practices there at the moment. So if you're a brand new user, make sure you use a unique name. So for instance, the Church Road Surgery pops up a lot. So make sure you put something like the Church Road Surgery Bristol. Because of demand from locums who are going around different practices but still want to do something, we're going to say you can sign up as a locum and do the bits that are possible for you to do as a locum. But if you're going to register, do this by putting in your practice name as Dr. John Jones, for instance, comma locum, and your address is Bristol, so you're not confused with Dr. John Jones in Cardiff. The registration code is 134. This is a security detail added by SOS. Who run the website, and it's just so that some random person can't come along and just register into your practice and mess with your data. So once you've registered, this is the login page, and you can see immediately that the tabs on the left have changed a bit, and that there's a score with each tab, and that's a way of showing how your practice is doing in each of these categories. But if you want to get a summary, you can also just click at arrow number 7, the achievement report, and you'll see this. So the top row is a typical general practice, and it shows how many actions have been taken, how many points you scored, and if you were a past user of the practice, it will show what you achieved last year. The middle row is all of the almost 900 practices on the toolkit and how they're all doing, and maybe the top scorers in the league table on the right. The bottom row is all the organisations outside of general practice who are also contributing to a green impact scheme of their own. This includes universities, student unions, local authorities, both in the UK and in some other countries. About 10% of the practices who are registered also submit for an award. And we've changed this and made this easier this year. So we've got a Pioneer award, just really for registering. Bronze, if you get 75 points. Silver, if you get 150 points. Gold, 225 points, and Gold Plus, 300 points. And Carbon, if you've achieved net zero carbon. And we've also made this a lot easier for practices in the last year. If we look at one of the categories in a bit more detail, we'll start on prescribing. You can see in prescribing that there's bronze, silver, gold, and carbon. And as you'd expect, the easier ones are in bronze, and they get progressively more difficult. And in bronze, there are 4 criteria and silver 3, gold 4, and carbon in 1 in this particular category. It's different in different categories, but that's the criteria for this particular category. So if we click on bronze and see that in more detail, the 4 bronze ones are, the first is comparing your practices prescribing, the second one's improved inhaler prescribing, the third one is reviewing your DPI versus MDI inhaler proportions, and the fourth one is reviewing patients who have more than 10 prescriptions. For the criteria at the top, this talks about open prescribing, where you can compare in England in great detail all your prescribing with all other practices in the country. And we add further information, so there are alternative schemes in other countries, and this is the sort of information we have to update each year as other schemes become available. So we're trying to, in this category, to say why it's important and also to make it easier for you to do. The next tab at the top is really how you will be audited. Now, when we started, we had a regular sort of cohort of students who would come round in June, July each year and inspect each practice if they submitted for an award. Now we've got far too many practices, so we're sort of doing random checks. It's a high trust award system. There's no reason for sort of lying about what you're doing on this. And if we go to the comments and evidence, this is where you put in the text to show what you've achieved, or download a file of previous evidence so that you can claim the points and move on to your next criteria. If you look at another category, travel and exercise, you'll see here that there's just one criteria in each of the bronze, silver, gold and carbon stages. And the bronze is promoting physical health, the silver is a staff travel audit, the gold is minimising patient and staff travel, and the carbon is promoting low carbon transport. And if we look at one final category, zero carbon, here we find that one of the criteria in bronze is learning about carbon literacy, and in the coming years, we're all going to be learning more about carbon literacy, and if you don't know where to start, here's a good place. You can go to the UK Health Alliance on Climate Change. You'll see that the Royal College of GPs is a founding member of the Alliance, with most of the other main medical and nursing institutions, and even veterinary and paramedic associations. And here there's a simple frequently asked questions about carbon literacy, little carbon literacy quiz, and pointers to where to go next to improve your knowledge about carbon literacy. But back to the zero carbon category, the silver level is using a carbon footprint software in your practice. The gold level is how you're planning to reduce that carbon footprint, and the carbon level is that you're demonstrating that you can actually achieve net zero carbon by 2030. So at the Royal College of GPs, we have our Climate Emergency Advisory Group, and we're trying to get sustainability into all parts of the system. It has to get into all parts of the system. It has to be one of those things that you think about every time you make a decision. And we're trying also to give people simple actions relevant to daily life, with green impact prescriptions, where we can say it's good for you and it's good for the planet. It's good for you and it's good for the planet. If we look at how we're doing in the UK at the moment, these are the per capita emissions in 2020, and you can see the UK is at more or less the average for the world, 4 tonnes of carbon dioxide equivalent per person. But what we're trying to get to is net zero, where that blue arrow is. So we've still got a long way to go. If you want to look at the Green Impact Toolkit in more detail, then you can log in on the login page with this GIFH at greenimpact.org.uk identifier, and just use the password test toolkit, and then you can see in sort of a dummy version of the toolkit exactly how it works in all ways. So in this climate and ecological emergency, we don't want the few doing every impossible thing. We need the many doing everything possible. We have to get to net zero as fast as we can. And if we get there, there are plenty of co-benefits. It's reasonable to believe that if we can get there at a worldwide, global level, then actually we can improve the lives of people and everybody else and every other thing on this planet for the better. Thank you.